Our first guest is Dr. David Fairbanks. He is the medical director of the Physician's Assistant Program at Rocky Mountain University. He's also the emergency director and chief of staff at South Bighorn Hospital. David, thank you so much for being with us.
Oh, I'm glad to be here. Thank you,
I can't
Amy.
believe you even have enough time to whisk in and do an interview. You sound so busy.
Oh, it's a lot of fun.
Yeah, so tell me a little bit about what you do in all of your different positions.
Well, I take care of people in the emergency room, and that's a lot of fun. You never know what's going to roll through the door, and you've got to be prepared for just about anything from a rash to a stroke or heart attack. So those are things we train for and things we do great. And and then at Rocky Mountain, I'm going to be helping develop their curriculum and teaching and working with the new PA students that are going to be applying, and the first class is going to be June of 2015, so we're all excited.
That's very exciting. Congratulations.
Yes.
That's great. So safe to say you've been in the emergency department for a while. Is that right?
Yes, longer than I'd like to admit.
For 10 years because you're 29, right?
No, it's been at least 24 years.
That's fantastic. That's great. So in all of your years of being in the emergency department, what are some of the most common things that people go to the emergency room for?
Well, some of the most common things are not necessarily things that necessarily need to be seen in the emergency room, but things that we really have to take care of in the emergency room are chest pain and stroke and abdominal pain and fractures, trauma, motor vehicle accidents, difficulty breathing.
So are some things seasonal? Like, do you see more of one thing in the summer and more of one thing in the winter?
Sure, absolutely. We tend to see sunburn more often in the summertime, obviously, but we can see it also in winter sports when people don't think about sunscreen and they're out snowmobiling and they come in and they're windburn and they have bad sunburns and pain, and so.
You know, one of the last time I went to the emergency room was for that. I was snowshoeing up Timpanogos, and I didn't wear glasses, and the glare was bright on the snow, and I was blind for 2 days. Yeah. It was very scary, and so I really identify with that. But so what are some things that people go for that they really should not go for?
Well, we're happy to take care of people in the emergency room for anything, but oftentimes it seems like we're there more for their convenience and for, single moms who are trying to juggle a career and job and don't want to have to take off work to schedule a doctor's appointment. We're happy to take care of those things, but they do cost a lot more money in the emergency room. You're looking at $573 for an appointment for strep throat, whereas in a doctor's office it'd be closer to 70 or sometimes even 50.
That's a big difference.
Yeah, that is a big difference. But things like rashes and urinary tract infections and earaches, even though they're concerning to parents and particularly new parents, and we're always happy to do that. Oftentimes, if they had somebody that they could call, a mom, or somebody that could help them, and give them some advice over the phone and say, that's, you had one when you were a child, here's what I did, those sort of things. But sometimes it's cheaper for them, or it's more convenient for them, or they just have a lot of anxiety for them to come to the emergency room and be seen rather than pick up the phone and make a long distance phone call to mom.
Yeah. Well, I know that when my baby is sick, the first thing I want to do is get her seen immediately, right? So that is helpful for me to know that, I can call my family physician, or I can call my mom and I can find out. So is there a good way, what are the procedures for me as a mom, I have 5 kids, they're 14 to 3. And so if they're up sick in the middle of the night and I don't know whether I should take them to the emergency room or not, what should I do?
Well, a good resource is having a family doctor, and a lot of people don't have a family doctor. I'm trained in family medicine, so I'm always going to say everybody should have a family doctor, because I really do. That's somebody who knows your family, knows your family history, and can be a resource to you. And usually there's somebody on call, so that they can take care of things like that, and they'll say, I'd be happy to see you at 7:30 tomorrow in my office to look at that ear infection. But if ever you have concerns, we're there in the emergency room. One thing that, the makers of pain medicine have done in this country is created a phobia around fevers, and I call it a fever phobia. And, people come in and they say, well, I understand if my child has a fever of 101, they're going to get brain damage. Well, probably not.
That's not going to happen. That is so good to know, actually.
Yeah, but a fever is the body's way of increasing your immune system and taking care of things. And a lot of bacteria and viruses are heat sensitive. The body knows that, and it raises the temperature to kill them off. And you're probably not old enough to have a grandmother who told you when you had a fever, the best thing to do was to get under the covers and make it even hotter. But my grandmother did that for me, and that's what they did before antibiotics.
Interesting. No, my grandmother told me to put the mustard seed thing on me, on my chest. So from what I've gotten from what you have said is that emergency departments are always happy to take you. It may not always be the most economic option. So in order to be able to tell whether or not to visit the doctor, to visit the emergency room, call your doctor, and there should be somebody on call to be able to tell you. Is that right? Okay, awesome. Any last words and what we should do?
Well, if ever you have chest pain, shortness of breath, or symptoms of a stroke where you have slurring of speech or weakness in a hand or something, it's very important because we have therapies, particularly in stroke, that we can do immediately and sometimes reverse those effects right away.
Okay, so for those reasons, go immediately to the emergency room. Okay, well, thank you so much, David.